Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to thank the DAR International Alliance Committee for inviting me and giving me the opportunity. My name is Dr. Hawazin Zarif, and I will be presenting virtual technology and type 1 diabetes. The outline of my lecture will be epidemiology of type 1 diabetes in Ramadan during the pre-COVID era, and then the pre-Ramadan assessment and education that used to be conducted and is still conducted during that period, epidemiology of type 1 diabetes in Ramadan during the COVID era, and then the pre-Ramadan assessment and education of type 1 diabetes in Ramadan during COVID. We're all familiar with the EPIDR 2004, the landmark study for diabetes in Ramadan, where they included patients with diabetes. 8.7% of those patients, approximately 1,070 patients, were type 1 diabetes. They were recruited. They were able to fast 72% for at least 15 days. And 48% of those patients were able to fast almost the entire month of Ramadan. Severe hypoglycemic episodes were significantly more frequent during Ramadan in this group in comparison to the other month. And the average number of fasting days was 23 days for the days that they were able to fast during Ramadan. And there was an inter-country difference where we can see in Turkey, for example, the fasting duration was 18.1 in comparison to Saudi Arabia, where it was 25.6 days for the month. So the results from this study and the prevalence that we see of hypoglycemia and hyperglycemia highlights the importance of the pre-Ramadan risk quantification. So patients really need to go thoroughly through assessing their risk of fasting. And if they're found to be suitable to fast, then they can actually be advised to follow the guidelines for patients that can fast during Ramadan by performing regular glucose monitoring, by drinking adequate amounts of fluid during the non-fasting hours, their dietary advice, their exercise. Also, each patient should have an individualized medication adjustment, and they need to be advised when they should break the fast. And then during Ramadan, again, those patients would require monitoring. So we would hear from them, we'd see the feedback, what were the issues that they faced, particularly in the first few days of Ramadan, and then we would make the necessary adjustment, and we reinforce the pre-Ramadan assessment during the Ramadan monitoring. So the studies that I'll be presenting now were all during the pre-COVID era. So this study looked into the role of the 24-hour helpline service in the management of diabetes during the month of Ramadan. And in this study, they enrolled 102 patients that had type 1 diabetes and a type 2 diabetes, and they were willing to fast Ramadan 2018. They had one-to-one pre-Ramadan education and a 24-hour helpline number, and self-monitoring of blood glucose record book was provided to the patients. So if we look at the results of the study, we can see that a total of 912 calls were performed. Majority, almost 527, were for the patients with type 1 diabetes. And interestingly, if we compare the reason for the calls, we can see that it was less reason to be called or to the patient to call their healthcare provider if they had hypoglycemia, if they're having type 1 diabetes in comparison to type 2, while the opposite, hyperglycemia, more patients with type 1 diabetes were calling because of hyperglycemia in comparison to type 2 patients. So the last 10 days of Ramadan, actually, it really clearly showed a trend down of improving the blood sugar monitoring in those patients with type 1 diabetes, especially during the pre-dawn meal and the pre-sunset meal, before sahur and before iftar, and even before sleeping. So there was a trend towards the last 10 days of Ramadan to notice this improvement. So the conclusion was that pre-Ramadan diabetes education and treatment adjustment by using a station-based 24-hour helpline service during the holy month of Ramadan had a significant role in controlling the blood sugar levels. And by this, it would minimize the acute complications of diabetes and facilitate timely adjustment in the treatment and reduce unnecessary hospital visits as well as admissions. Another study looked at the impact of telemonitoring on patients with type 2 diabetes. The participants were 37 participants. They were randomly, so it was a pilot randomized controlled trial. They randomly allocated them either to the telemonitoring group or to the focus pre-Ramadan usual care group. And the patients that were on the telemonitoring, they received goal setting and personalized feedback. Again, if we look at the figure, we can clearly see that the total number of hypoglycemic events that were reported by the patients were less in the telemonitoring group in comparison to the usual care, while from the table we can see that there was no change in the biochemical outcome at the end of study when comparing the usual care to the telemedicine. So in conclusion, the telemonitoring group was less likely to experience hypoglycemia than the usual care group, and there was no significant difference in the glycemic control at the end of the study between both groups. Participants viewed telemedicine as a more convenient alternative, although there was some issue with the technology, and that was considered as a barrier. However, they thought that it is more convenient. So this study really reinforces the need for monitoring as well as educational initiatives for Muslims with diabetes who are planning to fast Ramadan. Again, the same group conducted a prospective randomized control study, making Ramadan fasting a safer experience, MR-FAST. This time, it was more of a cluster randomization. So they randomized 5 clinics into 2 clinics received the telemonitoring group, and the other 2 clinics received the other 3 clinics received the usual care. So a total of 45 patients were analyzed in the telemonitoring group, and 40 patients were analyzed in the usual group. And again, same results have shown that hypoglycemia was significantly lower in the telemonitoring group, odd ratio of 0.186. So up until that point, when the COVID-19 pandemic hit us and there was lockdown in 2020, and at that time, the report from this study looking into Ramadan fasting in people with type 1 diabetes during the COVID-19 pandemic, the DAR Global Survey, a total of 1,483 type 1 diabetic patients were enrolled from 13 countries. Similar numbers compared before, 71% of type 1 diabetes fasted during Ramadan. If we compare them, if we look at the age categories, less than 26.8% were less than 18 years, and 73.2% of them that fasted Ramadan were actually above 18 years. And they were able to fast during the COVID-19 year 2020 pandemic. Hypoglycemia was high, as well as hypoglycemia as well as hyperglycemia. So hypoglycemia was up to 60.7%, and hyperglycemia was up to 44%. So they were a major complications of fasting during Ramadan during the COVID-19 pandemic. So the results from this survey highlights the need for Ramadan-focused diabetes education to improve glucose control and prevent complications during fasting. However, now because of the COVID-19 pandemic at that stage and the lockdown, the issue of face-to-face and the usual care was not possible at that stage. So from there, the role of education through technology raised, and the post-COVID-19 really gave us a lesson, and we went through the challenges by unable to arrange face-to-face interactions to allow clinical follow-up with the patient. So all the clinics immediately reacted promptly by communicating with the patients, contacting them through telephones, through mobile phones. So those were actually found to be convenient methods, and even more and more like Zoom platforms, etc. So telemedicine, telemonitoring, all of these have been identified as effective modes of managing the needs of people with diabetes. So platforms were available, phone calls were possible, WhatsApp group, telemonitoring, using emails, using videos, recording videos and sending it to the patients. And very useful was sharing data via the, for example, LibReview or CareLink or Dexcom, where we can actually see the data of the continuous glucose monitoring. So post-COVID, or actually during the COVID, we have, I will be presenting few publications. So we can see here from the publication from King Saud University that there was rapid implementation of a telemedicine clinic during the 2019 COVID-19 outbreak. And we can see here that the satisfaction from this study that the patients actually, approximately 97% of them found that the online session that was conducted, the pre-Ramadan counseling session for the patients, they found it very essential in helping people to maintain a glucose control during Ramadan. Also, they found that the knowledge was helpful. They found that the quality and the relevance of information was excellent. And the videos that were shared with the patients also, they found it excellent. However, when it comes to if they recommend continuing the diabetes and Ramadan session as an online meeting every year when the COVID outbreak is over, a little less than that, so around 88% strongly agreed to have those sessions and to continue on those sessions, while 9% were neutral and 2.9% strongly disagreed to have those sessions as virtual. The same group of researchers at King Saud also looked at the patients of a total of 151 patients with type 1 diabetes during Ramadan 2020. They categorized them into three groups. One group received a virtual education session. The other group actually had in-person, and the third group had no visits. So if we compare the use of CGM in these three groups, we can see that the groups that had the virtual education had the highest percentage of using the CGM in comparison to those that had no visits. And if we look at the time and range CGM, we see that 59% of the time it was achieved in the virtual group, while it was less in the in-person, and it was least in the no visit group. And if we look at the fasting odds ratio, we see that it is highest actually in the virtual group, where the odds ratio was 9 in comparison to in-person, where it was 3. So the conclusion was that a virtual pre-Ramadan visits are effective alternative to in-person visits when managing people with type 1 diabetes who plan to fast during Ramadan. A study from the National Guard that looked at the effect of the virtual education on glycemic control in patients with type 1 diabetes during fasting Ramadan. So the patients here, again, during the 2020 COVID-19 restrictions, they were contacted by phone, videos, either in the form virtual education in the form of videos and booklets were sent to the patients via WhatsApp. 89% of the patients were enrolled. 88% were found that they complied to self-blood glucose monitoring. 72% reported that they broke their fast if the glucose was less than 70, and 22% broke the fast if the glucose was above 300. 61% of those followed the insulin adjustment to basal and sahur doses and the adjustment of meal timings, which is delaying sahur. The basal HbA1c level from 8.46% decreased to 8.3 to 8.32% with a significant p-value. So the conclusion was that diabetes virtual education was well received and improved glycemic control and self-care among patients with type 1 diabetes during Ramadan fasting. So the study still not yet published, but in preparation of the manuscript, we looked into the impact of the fasting Ramadan in patients on insulin pump. So those patients actually received educational sessions live and recorded. The patients were also individually counseled, and their pump settings were adjusted. A total of 53 patients were enrolled in the study. And during Ramadan, physicians were actually responsible about reviewing and adjusting their insulin pump settings. The mean days of breaking the fast for those patients was found to be 2 days. So fasting Ramadan was fairly safe in this group of patients on insulin pump, with minimal days of breaking the fast. And when we looked into the correlation, if there was any correlation between the number of days they broke the fast and other factors, the only factor that was found to be significant was the use of flash glucose monitoring. So in conclusion, epidemiological studies highlight the increased risk of developing acute complications of diabetes during Ramadan and the importance of a Ramadan-focused diabetes education. Telemonitoring was shown to reduce the risk of hypoglycemia in type 2 as well as in a subgroup of type 1. And implementing virtual pre-Ramadan education visits has shown to be effective and safe alternative to in-person visits for managing people with type 1 who plan to fast during Ramadan. By this, I conclude, and thank you for your attention.